In this video, I'm going to talk about different developmental genes and the clinical presentations that result from their mutations. So the first gene I would like to talk about is WNT7 gene, which stands for wingless type. And this gene was originally discovered in Drosophila melanogaster. So Drosophila geneticists found out that flies that lack this gene do not develop wings. So wings do not develop in these flies. Later on, the same gene was discovered in humans, and it was found out that it's required for osteoblast function to induce developmental of the limbs. So limb development. And mutations in this gene causes phocomelia, where the long bones do not develop. So that's how it would look like in a patient that has phocomelia. They do not their long bones do not develop in these patients. The drug that can cause the similar symptoms is called thalidomide, and it was originally marketed in 1950s for morning sickness in pregnant females, but then later on they found out that it also causes phocomelia, and it's believed that it functions by inhibiting the function of WNT7 gene. The other gene I would like to talk about is the sonic hedgehog gene, and it functions in ectodermal functioning, and by that it induces developmental of the facial features. And so patients that have defects in sonic hedgehog gene will develop holoprosencephaly. Where the hemispheres of the forebrain remains fused and the facial features such as nose will be absent in these patients. So here is an example of holoprosencephaly from mutations in sonic hedgehog gene. The next gene I'm going to talk about is the fibroblast growth factor, and it's required for the limb development again. And patients that have mutation in fibroblast growth factor receptor 3 will develop achondroplasia. And how it looks like is that the limbs, the long limbs, will be short in these patients. So here they have short limbs. However, note that the size of the face and the chest, since it's being controlled by membranous ossification, remains normal. So the fibroblast growth factor receptor is only affecting the long bones versus the head and the chest, which remains normal in these patients. And finally, I would like to talk about the homeobox, which is required for the arrangement of the embryo in craniocaudal direction. And it also is required for the proper placement of the appendages. So mutations in homeobox causes improper placements of appendages, and so these patients will develop polydactyly, where there would be an extra finger in this patient that is placed right here because of mutations in the homeobox gene. And that concludes our discussion.